And Tom is right. Of course, he had inside information. I am going to talk about Helen Keller International's Homestead Food Production Program, which is something we've been working on for about 25 years. And basically, it's a food-based approach, but it has an essential combination with nutrition education and behavior change communication, and more recently, a livelihoods component. So I just want to review quickly 6 lessons we've learned over those 25 years, and then 5 things we really could be doing better. One of the most important lessons is get the design right. Understand the program impact pathways that you want to influence, and be sure that you're addressing not only the immediate causes of the poor nutrition, but also looking at the underlying determinants, which was something Tom just referenced. So obviously food insecurity, poverty, the low status of women, and linkages or the lack of linkages to health care. So design is key. Number 2, there are no cookie-cutter approaches. You've got to understand the local context and adapt your program design to it. You have to understand not only local farming practices, but local culture as well. And then you have to involve the community from the get-go, from the beginning of planning on through all of implementation. Local partners are going to be essential for this work to be sustainable. The role of gender is critically important as well, and you have to be sure that your programs are enhancing rather than undermining women. So, for example, if you've got a home gardening program, there can't be so much work expected of the woman to plant and tend the garden that takes her away from the care and feeding of her children. But you've got to be aware of other gender-based biases as well. Just as we can't assume women are not interested in marketing or commerce, we can't assume that the men shouldn't be involved in training in nutrition or infant and young child feeding. So that's something to always be really vigilant about, which leads to the 5th point, which is having an eye to equity. When we originally started out, we chose who the demonstration farmer was by looking at who had more land, who had some farming experience, and who had greater literacy and numeracy. So what were we doing? We were playing to the privileged household of the poorer households in the community. So we were actually inadvertently increasing inequity rather than helping. So we've developed several strategies around that now, whether it's having group ownership of a model farm, whether it's watching all of the farmers first and then choosing the model farm by the initiative shown. Lots of different ways you can let the group itself select who the village model farm is. And the 6th point, and perhaps the most important, is that these homestead gardens don't work without nutrition education. You have to have effective behavior change communication strategies to get the families to adopt optimal nutrition practices. The programs aren't nearly as successful without that.